Does anybody really like going to the doctor? Well, personally, I'd rather file my knuckles with a cheese grater. They have to take my blood pressure twice because, the first one's sort of unbelievable. And it's even harder for our pets because they have no idea what's going to happen next. So, let me know, do you have a pet who is nervous at the veterinary clinic or absolutely freaked out? And for some of them, they can become so afraid that they become defensive, aggressive, and impossible in some cases for the staff to handle them, to take a temperature, or even do a physical exam or give a vaccination. And this is a big problem. And that's because dogs who are afraid to go to the veterinary clinic, oftentimes their people love their pets as much as you and I love ours, but they don't want to go, so they postpone it. And there are far fewer cats being seen in veterinary clinics than there should be, because a much greater number of them are way too wigged out to go. So, thank you, Carolyn. By the way, in case we haven't met, don't need to, you can stay here, buddy. In case we haven't met, I'm veterinarian Dr. Jeff Nickel. This is Tony, our almost 15-year-old cat. He'll be 15 in, November. And Gaston is here someplace. Oh, he's hanging out behind me. He'll show up at some point. We are currently dogless with the passing of our excellent Border Collie, Miss America. So we have 2 cats. By the way, next week I'm going to borrow a dog from one of my sons because we're going to talk about dogs who just can't bear to have anybody trim their nails or treat their ears or even get an injection at the veterinary clinic or, an allergy injection at home. Some of these things, we can make a big difference with these things. And, Wonder, you're here. Wonderful, from Las Cruces. Thank you. And, anybody else who comes, if you can tell me you're here and tell me where you're from, I'd be delighted. And also, Misty from Albany, Georgia. Thank you for coming. And Jana, thank you. My boys George and my cat Eli, my poodle, and I believe they understand they are getting help. I hope so. Sometimes they do, We can empathize with our pets. There are different species and they see things very differently. And this is a big problem in veterinary clinics, but not just there. Sometimes when we try to give them medications at home or just groom them, they can get pretty nervous. And we have a lot of tools to help them with this thing. And we'll talk about just some of them tonight. So if you have questions, by all means put them in the comment line. I may end up answering a lot of them near the end because I want to keep my train of thought going, but put them in when they come to your mind and we'll get to them before we're done here. So I'd like to tell you a story about this little joker here, Tony. He's an older guy. He's going to be 15 in November. And something that is an absolute reliable malady of cats as they age is kidney failure. Doesn't mean it happens all at once, although it can appear to in some cases. But they gradually, over time, their kidneys wear out. Truth is, this species really, genetically, they're really not intended to get that old. In the wild, where, they're domestic pets, and they certainly belong with us, and they are wonderful companions, but genetically, physically, and behaviorally, they're hardwired for, a life of robust hunting as predators. But of course, they're also a prey species, meaning that in the wild, they can be a bigger creature's lunch. And so when they lose their speed and their agility just a little bit, their life can be over in the wild. And so the average life expectancy of wild cats, feral cats even nowadays, is only about 3 to 4 years. So when we get cats to be the age Tony is now, and we hope we'll get a good 18 years or so out of him, that's sort of a contrivance based largely on our good care at home, good diets, and good medical care too, which brings me back to this problem of people with pets who are afraid to go to the veterinary clinic, like so many cats. Boy, if we can help mitigate that, help them to feel better. Something that I sort of learned on my own was I would take Tony or Gaston, our other kitty, he's hanging out behind me here, to the clinic for, whatever. I'd put them in a carrier and drive them in the front seat right next to me and talk to them. And boy, Tony in particular would cry and complain. Well, finally dawned on me, why don't I put a towel over his crate so that he doesn't have to look out the sides and out the front? He can still feel the motion of the car, but he doesn't have to see. Well, he quieted right down. And when I get him to the clinic, he's much more relaxed, much less prone to hide under a towel when I bring him in. So, just the other day, Tuesday, 2 days ago, I brought him in for his routine blood and urine tests. And, the staff there helps me get his samples, and then I send him off to the lab because the courier comes, picks him up at the Veterinary Emergency and Specialty Center where I see my cases. So, I had some pets who I had to see in the exam room, but some of my consultations I was doing by Zoom. So, if I had a Zoom consultation, I just let him walk around in the room with me and climb up in my lap while I was talking to people on the Zoom call on my laptop. But of course, when there are other pets there, I put him in his carrier and then in a big cage back in the treatment room, because obviously we don't want him mixing it up with somebody's big dog. You don't know what's going to happen. So at one point, I had him in my exam room, and I had to bring something up to the reception desk. And I made the mistake of not closing the door completely to my exam room. And as I came back down the hall toward the exam room, there was little Tony's head peeking out around the corner of the door saying, "You coming back, Dad?" Fortunately, he didn't wander around the clinic. He's been there before. Sort of reminded me to be a little careful. Ann Manners is watching. Ann, wonderful. Thank you for tuning in, Ann. Ann is my excellent sister-in-law in Tulsa. She has 2 lovely cats there. And in fact, she's right now choosing some pet insurance, pet medical insurance, which I'm a big believer in that because people can then afford to do major medical stuff when it's needed, including behavior consultations if you come to a specialist like me. So, pet medical insurance, I'll put a plug in for most of these companies. She just said she's going with Nationwide, right?
That's an option.
Yeah, Nationwide is one good one. Another one is Trupanion. We've seen them do a very nice job of covering expenses. So, but look at deductibles, all that. So, all right. So we have Tony T here, and he did pretty well on Tuesday when I brought him in because I gave him an anti-anxiety medication before leaving home. There's a couple that we can use. Here's one in particular. This is called Gabapentin. And Tony, I'd like to get up and turn the camera around. You know what? Maybe, Carolyn, there. Would you hold this in front of the camera with the label so people can see the name? There you go. Turn it just a little bit counterclockwise. The other way. There you go. This is called Gabapentin. And thanks, Carolyn. And it is a very typically inexpensive medication. Many veterinarians keep it on their pharmacy shelf, but we prescribe it out of regular pharmacies often. It's an interesting medication in that, cost-wise, some pharmacies have a very different price for the same generic as others. So with many medications that your veterinarian prescribes out of pharmacies, or your physician for that matter, you can go to a website called goodrx.com. And it makes it so easy to use that even, of course, they know where you live. Everybody does. So, they give you the pharmacies, you put the medication in, and the milligram strength. This is 100 milligrams that we use for cats. It's the smallest strength. And it'll tell you what the price is at all the pharmacies near your house. And with this particular medication, there can be a very wide range. And sometimes the pharmacies you expect to have the cheapest price don't necessarily. Well, the nice thing about the gabapentin is that it comes in a capsule. And let me show you that briefly. And this capsule, like so many capsules, can you see that? Let me hold it against my blue shirt. Well, you can pull it apart very easily. Just take the halves apart like this, okay? Well, the stuff inside is a powder, and cats don't seem to object to the taste. So before taking Tony in, and I recommend this to many cat parents, and your veterinarian may not be aware of this, but you can tell the doctor, look, my cat's nervous. Maybe not so nervous that he's, spitting mad when he comes in, but also, he'd feel much better if he weren't so darn freaked out. So, about an hour, hour and a half before loading your cat into the carrier and bringing him or her into the veterinary clinic, open a capsule of gabapentin, mix the powder with a small amount of tasty canned cat food, okay? And then give that to your cat. If your cat has not been fed for several hours, that little rascal is going to be hungry and should polish off that little bit of cat food and take in the gabapentin. And doesn't cause anesthesia. But sometimes cats who are so freaked out, and historically have been, that they're aggressive, they're pussy cats, some of them. So when we take a cat into the veterinary clinic, of course we use a carrier. Now this is a relatively small one. I have a bigger one that I like to use too, but some cats prefer small ones, so whatever works better. And what I like to do is, many times your cat will just go in the door, but it shouldn't be stressful to blow your cat up to bring it to the veterinary clinic. So you open up the, you take the lid off, and it sometimes takes a person to give you a hand, but and if you cover your cat with a towel or something like that, you can load him into the carrier very slowly and gently, still covered with the towel, and then very gently and quietly put the lid on and snap the buckles. And then cover it with a towel, put it in the car very quietly, and when you arrive at the veterinary clinic, rather than carrying it by the handle, we have come to learn, this is a fear-free technique, I'll talk about that in a few minutes. You hold the carrier against your chest and carry it into the veterinary clinic that way. And this way you avoid the swinging and swaying that would occur, even if you're careful, if you carry it by the handle on the top. Now, what you want to do is make this as easy for your cat as you can, so that when it's on the counter or on the exam table and the doctor or the nurse comes in, then you can very quietly take the towel off, and then you've already unbuckled the lid, and with the towel handy you can raise the lid and then cover your cat back up again. And if a really scared cat, I have people cover the cat's head with just a little pressure on his neck and his shoulder so he doesn't feel like he's going to jump out, and the doctor can palpate the abdomen, get a temperature, palpate the back legs, the lymph nodes, that kind of stuff. Can reach under the towel with the stethoscope, listen to the lungs and the heart, and then we slide the towel back a little bit, and we can typically examine their eyes and their ears and their teeth. And most of the time, thank you for the hearts, I hope this is helpful, cats will tolerate that stuff quite well, but we've set them up for success because we have used the gabapentin first. Now there's another anti-anxiety medication that you can use in cats. It is labeled only for dogs, and it's called Sileo. And you probably saw me mentioning this last week. I'll show you this label. Many veterinarians don't have, oh, Monica, you're here too. Wonderful. Thank you, Carolyn. Move it this way a little, and then there you go, down a little bit. Perfect. And this is Sileo, down a little bit again, if you don't mind. There you go. Sileo. Thank you. And Sileo is a very low dose of a medication we've actually used for years as an injectable sedative in cats and dogs, mostly dogs. But at a high dose, it is a sedative, but at a lower dose, it has a very different action, and that is to reduce anxiety. And we use Sileo here very often for dogs who have noise phobias, like fear of storms and fireworks. But with cats, you can give them 1 dot, and it's measured by these dots on the plunger of this syringe, has no needle. You slide this between the lower lip and the gum. If you give it in their mouth and they swallow it, the digestive enzymes break it down and it's useless. Doesn't do any harm. But if you give it to your cat back there and close your little cat's mouth, and if they'll put up with it, nobody seems to object with the taste, but you know how fussy cats can be. So you do what works, right? So, you can give them 1 dot of Sileo, or you can give them, mix the contents of a capsule of gabapentin and a small amount of cat food. These are very, very safe. And it's much safer. People think, oh, I don't want to sedate my cat. Okay, look at the other side of this equation, though. If your cat's so nervous about going to the veterinary clinic that you have postponed it, your cat can be developing smoldering problems, and not just kidney failure, heart failure, internal problems like liver disease, stuff that would not be noticeable, the silent killer kind of thing. Well, that cat needs to get an annual exam, and when they get to be middle-aged and older, just like those of us who've crossed that threshold, they need lab work. And it absolutely should not be a struggle. And we have ways of doing this. And if your veterinarian's not clear, who else is here, by the way? Oh, Richard, you're here. Wonderful. Great to see you, howdy, pard. And Let's see, who else is here? I think that's everybody I've said hello so far. So anyway, you want to, come on up here, young man. Attaboy. And so if your veterinarian is just not interested in this stuff, and all of us should be, but if you really can't get the kind of interest in keeping your pets relaxed, you can go to a website called fearfreepets.com. Fear-free is a certification that veterinarians and their staff can get, and in fact dog trainers can get certified for them, dog groomers for them. They have training modules that are all done online specifically for those groups, and in fact they have a module for pet parents too. If you go to their website, fearfreepets.com, they've got a locator in there. You put in your zip code or whatever, and they tell you what the veterinary clinics are nearby that are certified fear-free. And honestly, I recommend that for any pet. Typically, if a veterinarian and staff are so interested in the well-being of pets, if they feel that empathy and compassion for the cats and dogs that they treat, they're probably mighty conscientious in their medical skills too. You're talking to somebody who's real committed. And so I can't say enough good things about Fear-Free. I got certified. I think it's wonderful. The training modules were developed by members of the Veterinary Behavior College, the same people who trained me in my residency. So I sort of knew that stuff anyway, but it was great to have the training. And so I'm a real big believer in this stuff. So let me ask a question, and maybe you'd put it in the comment line. Is Gaston still here?
Inside.
Oh, all right. Well, Tony T's gotten a little fussy on my lap, so I'd love to have a cat sitting with me. So Carolyn will collect up a cat, maybe get Gaston. So here's a little quiz question for people. If you had to guess of dogs who visit veterinary clinics in the exam room, what percentage of them are completely relaxed versus how many of them are showing indicators of anxiety? Now, this question has been researched, and so I have the answer. And we know that some of them, as I mentioned earlier, are just so freaked out we can't even handle them. Thank you, Carolyn. Tony T. Oop, you little character. Well, he's just a little bit tuned up. Okay, would you want to come up here and visit? Or he just wants to come and take the treat off the seat cushion. Anyway, so of all stages of anxiety, one end of the spectrum where they're completely freaked out and can't be managed, and we see a few of those, all the way to the other end where they're just a little bit nervous, but why should they be, right? What can we do, aside from anti-anxiety medications, just in terms of careful handling, fear-free handling? What percentage of them are showing any sign at all of anxiety? And put it in the comment line, and let's see who can come closest. Ann says 30%. Actually, Ann, that's a really good guess, and I'll tell you why. It's because that was the old number. And that study was done really on pets who were showing really overt signs. And this newer study shows pets, not just those, but with any level of anxiety. And we're talking dogs here in particular. Oh, Linda, hello. How do you get gabapentin in a really scared cat who's suspicious of anything in his food? Okay, I'll talk about that in a little bit, okay? I'm glad you brought that up, and Carolyn, please don't let me overlook that question. So, okay, I'll let you folks think about that. Ann's already put her guess in. Somebody else put their guesses in too, and of course then I'll tell you. There is another study, fear-related behavior in dogs in the veterinary clinic, okay? And I'll bring that figure up in just a minute. I'm also going to tell you about another one. And this one, while you think about what percentage of dogs are scared, this is the Journal of Veterinary Behavior. I know you couldn't read it because it was backwards. It was a mirror image. And this one is called In-Hospital Administration of Dexmedetomidine. That is Sileo, S-I-L-E-O, okay? Oral mucosal gel. Again, it has to absorb across the mucous membrane in the mouth between the lower lip and gum, back in that little corner next to the last tooth, for stress reduction in dogs during veterinary visits. This was a randomized, double-blind, placebo-controlled study. Let me just read you a couple points in the abstract. Visiting veterinary clinics has been demonstrated to be a stressful experience for most dogs. So I just told you it's over 50%. Ann's guess at 30% was pretty good, but it's the majority, and is a common reason that pet parents delay treatments for their pets. Okay? The use of dexmedetomidine oral mucosal gel, Cilio, has been shown to reduce stress during minor procedures at the veterinary clinic, as well as alleviate acute anxiety and fear associated with noise in dogs. Dexmedetomidine, Cilio, S-I-L-E-O, reduces signs of stress, vocalizations, avoidance behaviors, panting, trembling, urination, defecation. Pets do this in the veterinary clinic. They're so darn scared. In dogs during veterinary examinations. By decreasing stress in dogs during physical exams, we can diagnose more accurately and improve welfare in our patients. Well, veterinarians, every one of us took an oath when we graduated to reduce suffering and use our scientific knowledge for the betterment of people and animals. And this just hits to the heart of it, okay? So, yeah, Cilio really matters, and we have very good research. And let's see, Linda, 70%, thank you for that. The answer is actually 78% of dogs show some sign of anxiety, stress, fear, and in some cases, serious avoidance, crying, urinating, defecating, panting, trembling, pacing. The list goes on to the point of defensive aggression. 78%. So that was a really good guess. So thank you for that. So what can we do about this stuff? And by the way, if you find this information helpful, you're certainly invited to share this video with any of your pet-loving friends. And if you want to get my Facebook Live videos every Tuesday morning and my weekly media blog, which also serves as my column in the Albuquerque Journal, every Tuesday morning, it can arrive in your mailbox, your email box. All you have to do is go to my website, drjeffnicol.com. That's drjeffnicol.com. And go to the bottom of the page, and all you have to do is put your email address in. It doesn't cost anything to subscribe, and those things will happen automatically every Tuesday morning. And when you subscribe, I will also send you at no charge my at-home pet first aid and CPR guide, which if you print that out and keep it handy, can be a lifesaver. So here's what I like to suggest that we do with dogs who are afraid in the veterinary clinic. Number one, a 10 by 12 exam room, and they're in there first, and they're nervous, and then the doctor or the nurse comes in, and all they want to do is get the heck out of there, right? They're scared, and they want to create distance. How the heck are they going to do that? Well, they really can't, and some of them will panic. And when we rehearse those ramp-ups in the neural circuits and the long-term memory storage in the brain, those neural pathways actually get stronger with modern brain imaging methods like fMRIs and PET scans. Those things are nowadays measurable. And so these problems get worse. And, we're into kindness if we love our pets. And so here's what we can do. If your pet is scared, ask your veterinarian to examine him or her outside. And what I often do outside, away from the building, is I squat down with my back turned toward the pet, the dog and its person, and the dog is led up next to me by its person, up to one side of me, and then its person squats down next to the dog, holding its shoulders like this, and I'm squatting on one side of the dog, its person is on its other side, and we're all three of us, both people and the dog, are facing the same direction. So it's not this face-to-face thing. I have not approached the scared dog. I haven't leaned over or reached for it. Those are fear triggers. We're just squatting there next to each other at the same level. So the dog doesn't have to fear this big scary person leaning over him. And I can often do a pretty good exam that way. Now, if it's a dog who might snap out of fear, that dog can learn to wear a basket muzzle. Baskerville muzzles, like Hound of the Baskervilles, are without question the best. Your dog can learn to put its face in that. And then the veterinarian or the nurse don't have to be worried that the dog's approaching them from behind. It might bite them. Okay? So that's just one good way of doing it. For many dogs, though, it's as simple as the doctor or nurse is already in the exam room when you lead your dog in. And the dog believes that it's choosing to enter the exam room, not that it's, oh my goodness, these scary monsters are coming in and I have no way of escaping. They're already in there. And the dog walks in next to its person where it feels a little safer. And if the doctor or nurse is squatting, they're going to seem a lot less of a perceived threat. And also, if they're not looking eyeball to eyeball, maybe turning their side or even turned around, much, much healthier behaviorally for the pet, and we can get our job done better. So, I've got one more study I wanted to read to you. This is for pets, dogs in particular, who are so freaked out that they become defensive aggressive. Okay? And we just got to give them medical care, but a rodeo to hold them down, that is not okay. Great deal of stress. It can be dangerous and can change lab values. I mean, that sort of thing should be completely off the table. Well, there is a gel made by the same company that makes Cilio. It is not approved for use in dogs. We have one very good study on it, the use of oral transmucosal detomidine gel to facilitate handling in dogs. And this was done by one of my colleagues. We were residents together when we were behavior residents, Marie Hoffensberger. She's the lead behaviorist specialist at Michigan State University College of Veterinary Medicine, which is my alma mater. And so anyway, Marie did this study during her residency. And this has to do with this gel that, again, is cleared for use in horses. But she determined the dosing of it based on a dog's body surface area. And I have used it many times and recommended to many of my colleagues in general veterinary practice, where the person, the dog owner, the dog parent, if you like, we measure it into a small syringe, not an injectable, there's no needle, and they give it to their dog outside the veterinary clinic, maybe next to their car in the parking lot, between the lower lip and the gum. And then they lead the dog into a darkened, quiet exam room where they camp out and wait in the dark, quiet, for close to an hour. And by that time, these dogs, well, they're pussycats. And nobody struggled with them. There's been no injection. And so then we can do our exam. And when we're done, sometimes we've taken x-rays with this. If we don't get quite enough sedation, we can add a little bit of injectable. There's no struggle then. And when we're done with them, there's an injectable reversing agent. Get them on their feet in 15 minutes. They don't even need a designated driver. So, you know, we use medications as needed. We know they're safe. We have very strong research. And we need to practice good medicine on every pet. Everybody needs preventive care. Everybody needs to have those early smoldering problems recognized, and those happen. And we need to extend high quality life, and modern medicine is pretty good at that, but you got to get the patient to the doctor. Okay? So, yeah, I don't like going to the doctor either, and yeah, it's like filing my knuckles with a cheese grater, but I go anyway. But I do know what's going to happen next, and our pets don't. Okay, so there were a couple of questions here. How do you get gabapentin, this is from Linda, into a really scared cat who is also suspicious of anything in his food? My veterinarian provided some, but I can't get it in my cat without scaring him. I'll check out the Fear Free website. That's a really good one. And interestingly, Tony here, who I have given gabapentin to before, in fact, most recently on July 4th, because he has a history of being frightened of fireworks, and boy, we have that around here. So I mixed a small amount of it in his food about an hour and a half before the fireworks started, and it worked out well, and he did great. But then, just a couple of days ago, when I wanted to give it to him to take him into the clinic to get his samples, he didn't want it. So, I mixed up a little bit of food. And our cats in particular, we typically feed them canned food. It's higher moisture, and that's better for their kidneys and their bladders. Good research on that, too. Well, Tony, Carolyn, maybe I could have one for my lap. Let's try that. We're enticing them with what we call kitty crack because we never allow them to have dry food. And so when they do get it, they do whatever it takes. So if your cat seldom gets canned food, Linda, you can, or seldom gets dry food, I'm sorry. I put a few pieces of the dry food kind of on top and mixed in with this small amount of canned food that I mixed the gabapentin in, and that worked. You know, some cats you can add a little bit of tuna juice, maybe a tiny bit of canned tuna. Try to dress it up. Now the last point on that is that there are compounding pharmacies. These are pharmacies that don't just dispense medications, but for some people and for pets, they will mix the medication in a tasty liquid that the veterinarian has to call and prescribe it, and you can use that. And it's pretty easy to mask the flavor of gabapentin. Your cat's fussy, so many of them are, but I've done that too, and I've been able to get cats to take it. Now, one word of caution, pharmacists, just like most people in the medical field, are very interested in helping. That's what we do. And they will point out many times that, hey, you know what, there is already a gabapentin oral liquid made for people, and you can simply give that to your cat. It doesn't have to be mixed with anything tasty. It's already tasty. Here's the problem. Many of the generic brands of gabapentin liquid have a sugar substitute called xylitol, spelled with an X, X-Y-L-O-T-O-L, or X-Y-L-A-T-O-L, I think. Well, this is potentially highly dangerous to cats' kidneys. So we don't let them go anywhere near xylitol, cats or dogs. And by the way, that sugar substitute xylitol is found in a growing number of prepared foods for people. It's actually quite healthy for people. You'll find it in peanut butter, breath mints, toothpaste, candies, lots of stuff, particularly for people who are diabetic. And you've got to be careful because pets will consume this stuff and it can be big trouble. So don't, just tell the pharmacist, no, I'm not going down that path. We need to mix this with a tasty liquid like fish flavored liquid, something like that. But Linda, I would ask your veterinarian to call that in, or try it with a little dry food like I've done with Tony, because you're going to need that in the future. And your cat needs medical care. Gabapentin is probably the safest medication we have for any species, including people. 100 milligrams, if you get the whole capsule full of gabapentin into your cat and you take her in and your doctor says, she's still just a little bit too nervous, then go with 1.5 or 2 capsules. If your cat is kind of sedated from it, there's nothing in the world wrong with that. That's how safe it is. So anything, almost anything, is better than not getting medical care. That's kind of the upshot of this whole Facebook Live. So let me see if there are any other questions. Oh, Fran, my brother passed away 2 weeks ago. Oh my God, I'm really sorry. Oh, jeez. You haven't had any time at all to process this loss. And he's just not been himself. I know it's soon, but how long is normal for a dog, or is it like humans? Your brother's dog, I think you're talking about. Well, I get that completely. People often joke about cats, being aloof and not being bonded. Well, Tony here, he lived with Miss America. She was almost 14 when she passed away just 3 weeks ago. And, she herded these cats, he and Gaston, and went to find them when we asked her, go find Tony or go find Gaston. Or when our kids were still at home when they were younger, go find Jake or Frank. Or I'd say, go find Mama. Whoever it was, she would hunt around, sniff them out inside the yard or outside the house or out in the yard. And she would just be delighted when she found them and go up and touch them gently with her nose. And you would think, well, would a cat really care? Oh, when Miss America passed away, Tony in particular was really upset. He's almost completely stopped eating for a few days, to the point where I got concerned. He paced, he looked around, and often just sat there. And his eyes were dilated. He was really upset, and he looked at me like, well, are you going to bring her home? I mean, how do you explain this? There was a very strong bond. And so dogs in particular can be very bonded to their people, and when someone like your brother passes away, it can be so stressful for the dog it breaks your heart, but also significant stresses can put anybody at risk of illness. And so that's worth treating. If your dog is, if you can do some more play, go for more walks, very often that will help them get through it. As long as they're eating well and they're not having stress-related diarrhea, that kind of stuff, you can probably do that with just more hands-on care and gentle play and that sort of thing. But if the appetite suffers, or if there are physical symptoms that go on longer than a couple of days, then sometimes we use antidepressant medications on dogs, and then we wean them off as soon as they feel better. And there are other things you can do, like food dispensing toys and puzzles. Some of these food dispensing puzzles with dogs are meant to be interactive with a person. You go to a website called, Nina, N-I-N-A, Ottoson, O-T-T-O-S-O-N, Nina Ottoson. And that website has a growing number of interactive food puzzles you can play with a dog. And you can get this dog to enjoy some things. We've got to grieve. We have to get through it, whether it's our family with Miss America passing away or your brother's dog. But if we sit and brood on it, we can get worse. And we absolutely need to have good care. God, I'm really sorry about your brother. But they sure do. And Sid, thank you for coming again. Our veterinarian didn't have the Cilio, but we did get the Trazodone. It definitely helped the fourth. Thanks for all your info on this, which also appeared in the paper. I've shredded over and over. Trazodone is another good medication. I have no argument with that at all. Oh, Wanda, you're here too, from Las Cruces. Thank you. So, yes, Trazodone is a good one. Sometimes veterinarians will prescribe that for dogs, and you can give it to cats too. It's a tablet. It's hard to get away with crushing that up in the food. But you can give that prior to veterinary visits. However, it takes at least an hour and a half, if not 2 hours, to become effective. You can instead give gabapentin to dogs. You can give them both together. Nothing wrong with that. And what's best? If your veterinarian will help you to adjust dosages and be willing to do some trial and error, sometimes giving one of these anti-anxieties prior to bringing your dog just into the reception room. Many people say, well, come with the dog often. You can do that, but it takes hundreds and hundreds of repetitions, and you have to make clear to the staff at the desk that their job is to ignore when you bring your dog in. Really. They love pets. That's why they work in veterinary clinics. And they tend to just get happy and delighted, like that's going to help the dog be happy and delighted. And most scared dogs get more scared by that kind of happy routine that the staff can, well-intentioned, it can actually make the problem worse. So you can do that, but if you give your dog one of these anti-anxieties and you want to just try it out, you can bring the dog or the cat in the carrier and bring it in and just watch your dog for those, the scanning, the looking around, the tension, the panting, the lip licking, sometimes trembling. And if you start to see that stuff go away, then you know you're moving in the right direction. So thank you again, everybody, for sharing this time with me. I love to help people make a difference. The business that I'm in is bringing out the best in pets and their people. And I'm really glad that you're interested and that you attend these things with me. And I want to just encourage everybody and everybody you know to take the time to give your pets the choice, the freedom to behave in ways that they are genetically programmed to do. They need to do things that are different than our species. You want to build a foundation of trust and choice and freedom before you ask your pets to do anything differently for you, because dogs and cats, just like people, if their leader only wants their needs met, they tend to become obstinate. But I can tell you something else from a lot of experience, is that our pets can learn any time during a relationship that they can trust us not to intimidate them. So people have made the mistake of, punishing or believing that they're doing the right thing to try to change your behavior and it actually leads to fear. Pets are the most forgiving creatures I've ever known, and you can start over. They will give you a do-over, and with the best advice, you can make these things into good relationships. So take heart, and again, if you are interested in a Zoom group conference, it's much less expensive than an individual consultation. Next Wednesday at 4 o'clock, right, Carolyn? We're going to have a group of 4 people. There's still a couple of spaces available. And in particular, if your dog has trouble in the veterinary clinic, it's a perfect time to bring it up. But any kind of behavior issue with a dog, you're welcome to attend. Just go to my website, drjeffnickel.com, drjeffnicol.com, and right there on the homepage you can pick Zoom group conference or group conference, and you can put your name in there, put your credit card, and sign up. So I hope to see you if you need any help, but if you have other questions, put them in my Facebook page. It's perfectly okay. So thank you again. Tony T, would you say goodbye to our friends? He says, well, I'm sitting over here looking in the backyard just in case a grasshopper comes by who needs some attention. Come here, Tony T. I want to show just everybody that you're a pretty good little cat. So thank you for coming.